Our next presenter, as I mentioned, is TaylorHuey. I hope I'm pronouncing that, and if not, please correct me, Taylor. Taylor's mentor is Dr. Casey Sherman, and Taylor's presentation this afternoon is analyzing Texas prison system deaths in custody, math behind bars. And I am going to get out of your way and let Taylor take over for us this afternoon.
Thank you, Dr. McCracken. Yes, hello everyone, and thank you for coming to my talk today. My name is TaylorHuey, and I'm a senior mathematics major here at St. Edward's University. Today, I will be presenting my research that I've conducted regarding deaths in custody in Texas with the guidance of my advisor, Dr. Sherman. But first, a quick overview of my talk. So we'll start by an introduction detailing incarceration and relevant research relating to that. Then I'll discuss the methodology of my research and what data I was able to collect and what that actually tells us. After that, we will look at an analysis of that data before moving on to conclusions we can draw from it. And lastly, we will end by looking towards future research worth exploring. So as it has become more apparent this past year, the United States is facing an incarceration crisis. The US has the highest incarceration rate in the world, and our prison population continues to rapidly expand, increasing by over 700% in the last 50 years. Looking at our own backyard, the state of Texas has an incarceration rate 20% higher than the national average. This translates to harmful effects for those incarcerated, such as a decreased life expectancy and a diminished quality of life. In 2018, the life expectancy at birth in the US was 78.7%, while most comparable nations such as Spain, Switzerland, Japan, Canada, and Australia had life expectancies above 81 years. In a 2016 study from Professor Christopher Wildman, he proposed that the explanation for the United States falling behind in population health metrics, such as life expectancy, can be attributed to mass incarceration. Waldman found that when comparing the US to other developed democracies, the life expectancy from 1981 to 2007 would have increased by more than 5 years if not for mass incarceration. He reasons that without having so many people locked up, life expectancy at birth would have increased by 51.1% more than it did in those years. And he points out that because of not only the high incarceration rate, but also the racial inequality of inmates in the United States, the effects of incarceration may be observable at the population level. Looking specifically at men, the incarceration rate of Hispanic men in 2004 was almost triple that of white males. And in the same year, the incarceration rate for Black males was over 2.5 times that of Hispanic males. And his findings aren't unique. In 2013, analyzing New York State Patrol administrative data from the state correctional facilities from 1989 to 2003, Professor Evelyn Patterson found a linear relationship between incarceration and life expectancy. She found that for each year spent behind bars, an individual can expect to lose 2 years off their life expectancy. In her study, she found that 5 years in prison increased the odds by 78% and reduced the life expectancy at age 30 by 10 years. And with over 2.3 million people locked up, mass incarceration has shortened the overall life expectancy by 5 years. While the Bureau of Justice reports that 41% of jail deaths occurred within the first week of a person's stay, the Huffington Post elaborated on this data further and showed that a few days in jail can be life-threatening. They found that 26% of jail suicides occurred within the first 3 days. And lastly, since the COVID-19 pandemic began rapidly spreading this year, the ACLU has released countless reports detailing how jails and prisons are amplifiers of infectious diseases due to their close quarters and lack of adequate health care. These findings and many more inspired me to craft my own research on the prison system for my honors thesis. So now we'll look into the methods. For my sample, I took data from approximately 10,000 deceased Texas inmates over the course of 2 decades, and this data was provided by the Texas Justice Initiative. Since my data is comprised of all deceased inmates and none that were released, this data and research is only applicable to incarcerated inmates who are deceased or become deceased. To collect my data, I downloaded the appropriate files, cleaned and recoded as necessary, and then began analyzing my data in different computer science platforms. So before I began analyzing my data, I derived these research questions in my thesis statement. I asked what factors relate in circumstances in which an inmate dies, and what factors relate to the demographics of deceased inmates. Then, my thesis statement, I hypothesized that there exists racial, gender, and age-based discrepancies in prison system deaths. For most of my data, I compared categorical variables, so I'll walk you through that process. So we have two categorical variables here, race and sex, and I want to compare if they're related at all in an inmate's death. To do this, I use chi-squared, and chi-squared is going to tell me that if everything is fair and equal, what the probability, what the discrepancy is between what I actually recorded. So you can see from the first line, the Black females had a count of 185, while they were expected to have a count of 164.559. So their count is higher than expected. And this throws off the chi-squared, and the last number they show is the contribution that this has to the overall chi-squared. Our null hypothesis is that sex and race are not related, and our alternative is that they are. To test which one is correct, we look at the p-value, and we see that since the p-value is less than alpha at 0.05, we're going to reject the null in favor of the alternative. So we conclude that sex and race are related when it comes to an inmate's death. Looking at the next chi-squared table, we see that I'm comparing the sex and race, but now recoded race as Black versus not Black. And we run through the same steps and we look at the p-value. And since it's higher than alpha, we conclude that we can fail to reject the null and accept that sex and race, looking at Black versus non-Black inmates, are not related. So this was a very small example, but for most of my data, I looked at categorical variables with much more groups to be compared. So for age, I put them into groups of roughly 10 so that I could do chi-squared analysis. And for manner of death, I cleaned out some of the missing files or sometimes recoded as necessary, but the data was already given such that the majority was natural causes, and in age group, the majority of those deceased were from 50 to 59. So this is what our chi-square table looks like for a bigger set and comparing age group and manner of death. And the red dots represent places in which the account that was actually given is higher than expected. So these are throwing off our data, but so are the blue stars, which represent counts that are lower than expected. And you can think that a count that's lower than expected is good since we're talking about deceased inmates, but that also means that looking from 18 to 29, that it's going to throw off some other findings. And in some cases, it's not great. Looking at 18 to 29 for natural causes, we would rather see natural causes as a cause of death than homicide, for example. And then the last piece of data that I'm going to show you guys today pertains to suicide. And I looked at the days a prisoner spends in custody in relation to suicide. And I found data consistent with previous research that I've seen, and that a large majority of deaths occur in the first 3 days with, not quite a majority, but almost a majority occurs in the first 3 days, and the majority of deaths occurs in the first month of a prison stay. And then for further explanation, because the large majority of my suicide deaths were from white males, I also ran comparing age and race for deaths due to suicide, but I found not a large discrepancy between the race. But what I did find was that the deaths or the age for suicides was much lower than our overall data. So overall, an inmate average death age was 49.85 and the median was 51. But for suicides, our average was 36 and the median was 37. So that's about a 14-year discrepancy. So now for our conclusions, we conclude on the gender-based front that since for Black women, women, and Hispanic men, it was higher than expected. So there was a significant correlation and uh, uh, areas for conclusions in that regard. And then age-based, we find that younger people, people who are under 40, are more impacted by suicide, homicide, and drug use, and that in suicide, um, that those numbers are similar, and that suicide um, death, inmates who died due to suicide are died in the first 3 days, and they are consist of mainly white males. So for future areas of research, I want to expand to a broader population. So inmates and prisoners that are not necessarily deceased, so that can draw further conclusions more applicable. And then I think that because of the data presented around jail suicides occurring in the first 3 days, there needs to be significant research done on the evaluation of mental health resources available to inmates, especially as they're impacted in short jail stays. And then I also want to draw a narrow focus on my data, such as looking at just homicides, just suicides, and that's where I'm at right now in my research. Here are my references. Thank you so much to Dr. Sherman for advising me, and thank you all for listening.
Thank you, Taylor. So a quick round of applause for Taylor from everyone. Feel free to unmute yourself if you'd like her to be able to hear. So as always, please feel free to unmute yourself and ask Taylor your question directly. If you would prefer to use the chat, please feel free to do so. And I am happy to pose your question to Taylor. I know we've got to have questions out there. We'll give everybody a few minutes to kind of pose their thoughts.
Okay, I've waited long enough, Taylor. I'm going to ask you a question. First of all, I love the research, and I love that it's so social justice oriented. I think it's really, really commendable. Question, what was the biggest surprise you came across? I noticed with the blue stars and the red dots, I like the way that you complicated that finding. It doesn't mean it's a good thing necessarily. It just means the data, if you dig deeper, was there any major finding that you came across or any number that just kind of jumped off the screen to you?
Not necessarily a number. I was surprised by the suicide discrepancy amongst white men, but they also represented a large part of the population or the sample. I think the most surprising thing was cleaning my data. I couldn't just drop missing entries because, for example, there was a column on make suicidal statements, and there were a lot of missing entries for that. So that would have deleted roughly 90% of my data sheet. And then what was the most surprising, I think, was that the NAs or the non-applicable or empty columns were for columns that you should definitely know the data for, such as the location of a person's death. So those missing cells were the most surprising thing that I found, I think. And then also that the age was so low, that the average age was around 40, 30.
So because I want to ask a follow-up to Chris's question. So because you were in this data, do you have a hunch about the missing cells? Like, do you have a sense of why the location wasn't provided or wasn't available? Total speculation, I realize, but you've been in the data.
Sure. I think for some of it, you can attribute NA or missing files to carelessness or just miscoding. Like some people put in negative ages. So that could just be miscoding. It could be that the way that they're inputting the data, like whatever software they're using needs to be updated. And then I guess on a more malicious front, it could just be that they don't want to say. That was something else I was kind of struggling with looking at this data, is sometimes it's only as true as whoever put it in, I guess you could say. And also the way that it's coded isn't necessarily showing. Okay, so for example, for someone who is death by homicide, you're much more likely for that to occur in pre-booking, which makes sense because if you're going to be killed like by an officer, which was the large majority of pre-booking and homicides, it's going to happen before before you are in jail or prison. Another thing was like natural causes is going to be a higher draw from, but that doesn't necessarily mean that that person did die from natural causes, especially if there wasn't a medical examination, which you can also see from the spreadsheet. So.
Wow. Okay. So one of the questions that came in the chat, I don't know if you're going to need a whiteboard or not, but it asks, can you explain chi-squared a bit more, please?
Yeah, I think actually I will use the whiteboard feature because it is, I don't know. I'll talk it through, and then if you need me to use whiteboard, let me know. But let's say you have a sample of 100 people and they're male and female and black and white. If everything was fair and everything was true in the world, you would have 25 people in each of those cells. So for black women, it would be 25. For white men, it would be 25, and so all 4 cells. The data you're actually going to get isn't going to be 25, 25, 25, 25. You might have 10, 40, 20, 30. And so chi-squared is going to tell you the discrepancy between the two, and that's where you see the contribution of chi-squared. And then the p-value tells you how likely your overall data set is to occur when comparing to the way it should be, like normally distributed. So yeah, so we use alpha as like a marker, but you could pick a different marker, like 0.01. And then the second test that I showed, black versus non-white, would have failed and we would have accepted the null. Sorry, I tried to use less math language because I know it's kind of hard, but I hope that helps.
It helped me. Best description ever. Excellent. Other questions out there? Again, feel free to unmute yourself, or please, you're welcome to use the chat if you would prefer. I think I would like to know kind of how you see this research fitting into the next steps for you, the next, whether it's grad school or industry or workforce, kind of like how do you see this work kind of moving you forward into your professional life after graduation?
That's a good question. So I mainly started this as kind of like a labor of love when I contracted Dr. Savala's course. But I would love to work with, and I've reached out to different people to work with, like the Texas Justice Initiative or with the Innocence Project. And I'm actually pre-law tracked, and I'm taking legislation and lobbying next semester. So I'm hoping that I can somehow implement this into the course or implement this into what I want to do in the future. But yes, I definitely want to continue advocating for prisoners' rights, even pro bono, if that. Mm-hmm.
Thank you. Comment came through in case you can't see it. Amazing research topic and so applicable. You are amazing. I think we all agree with that. Other questions?
Mariah, could I follow along the question that you asked? Was somebody else starting before I blob out a question? Okay, Taylor, I'm curious because this is a very hot topic, right? Because the topic of policing reform is so present and will be one of the big topics in the legislative session in the spring. So if you could sort of wave a magic wand, what do you think should be a legislative priority in terms of addressing some of the issues that your research uncovered?
I think definitely prisoners' rights should be a priority. I was really happy with California's decision to allow prisoners to vote that was recently passed. I think we need to start looking at prisoners as people. And I think we need to push for prison reform that encompasses shorter stays and less stringent policies. That's what most democracies have. Most, I guess, like the NATO countries are what we've been compared to. That's what they have, and I think it's because they care about their citizens. But they're much more of a homogenous society usually, and I think that plays into part. I think that if I could wave the magic wand, it would be releasing everyone on drug charges, and then allowing prisoners to vote, and increasing the health and care that's put into prisons and jails. Yeah, I think I would abolish the prison system.
I love it. You have another question. This one is about your data set, I believe. And the question is, did you look at reasons for incarceration as part of your research?
I don't remember if, when I first downloaded the file, I got a lot of columns, and I don't remember if that was one of them, but I do want to look at that because that in the clean data sheet I have, it wasn't in there, and then I didn't want to re-download the data because then it wouldn't be comparable anymore. The other thing is that I took this data like in the beginning of January, and that was before COVID really started striking. And I'm not sure if I emphasized enough how much of a hotbed jails and prisons are for COVID, and we're still like getting that data in. And the count right now, I think, is almost to where we were last year at the end of 2019 as far as incarceration deaths for Texas. So I haven't started analyzing the data now yet because I think even like the ACLU is a little bit behind on it. They have the projections, but you can't really nail down the results right now. But I do want to look at the reason someone's behind bars because I would like to see if, if you're in jail for murder, do you murder someone? Do you kill yourself? Like what happens?
Thank you. And we have time for, I think, one more, if there's one more lingering question out there for Taylor.
Taylor, this is Caroline Morris. I liked your presentation very much. Thank you. I'm curious, having really dug into this data, what barriers you might anticipate to accurate data coming out as we see COVID-19 really impact prison systems.
I think timing is a big thing. So before a vaccine, I would be very hesitant to draw conclusions. I think that when the data that's presented now, people are largely making projections. That's what I've seen. And so I would believe those projections, but I also, I'd be very hesitant to say that we're going to get data on, well, actually, it depends on, I guess, what our incoming president would like done, and if he allows more tests to be done. Because early on, we saw a lot of data showing that prisoners were at like 70%, for example, in federal prisons testing positive for COVID. I would be hesitant as to the source, but also as to what resources we have available for prisoners as far as testing goes. But I think the projections are pretty accurate as of right now.
Thank you so much. We are almost out of time, but not out of time for another round of applause for Taylor. Feel free to unmute yourself so she can hear the loveliness. Feel free to yell. Excellent work, Taylor.
Hey, Taylor.
Go
Taylor. Go Taylor. Woo!
So